After today, no more wound care. Wound management only. How are you going to do that? I'm going to tell you. My name is Jesse Cantu. I am a nurse and a certified wound specialist. I've seen all types of chronic wounds, from the surgical dehiscence to a 17-year-old venous leg ulcer. I have had the privilege and the opportunity to work with thousands of healthcare providers where I share my experience and best practice protocols to move stalled wounds into healed wounds. So what's the difference between wound care and wound management? Well, I've learned that it starts with looking at the whole patient, not just the hole in the patient. This allows to identify and remove barriers that delay wound healing. So topically, how do we want to approach healing chronic wounds? Well, we know we want to remove the necrotic tissue, we want to manage the exudate, we want to reduce bacterial load. In essence, our goal of therapy is to obtain a moist wound healing environment. How are we going to do that? Well, let's start with the multidisciplinary team approach. To collaborate with the physician and the nurses, we might add other team members, such to include the surgeon, the endocrinologist, the physical therapist, dietitians, just to name a few. Next is a comprehensive wound assessment that includes the etiology and the wound location. Is the wound shallow? Is the wound deep? Is it wet? Is it dry? Is it infected? Is it necrotic? What other tissues are in the wound bed? Granulation, good. Epithelialization, good. Slough or eschar. Now let's look at assessing the patient systematically. We look at all kinds of systems: cardiovascular, pulmonary, musculoskeletal, the skin, integumentary, psychosocial, to identify comorbidities such as diabetes. After assessing, we now need to identify both local and systemic barriers that delay wound healing. From there, we can now remove those barriers that cause the delays, and we can develop a treatment plan. As part of the treatment plan, we need to select the appropriate wound dressings. But where do we start? Well, when I started as a nurse, there were 4 wound care products in the market. Today, there's over 7,000 wound care products in the market, which can make it very confusing when selecting the appropriate dressing. Your goal is to maintain a moist wound environment, in addition to extending the dressing change interval from a daily dressing to 2 to 3 times a week. Based on your current product availability and following best practices, you're going to select the next most appropriate dressing to achieve your goal of therapy in a timely manner. Medicare guidelines expect wounds to reduce in size by 20 to 40% in 2 to 4 weeks. You are not seeing these results. You need to reassess and reevaluate the treatment plan. Now that you know the difference between wound care and wound management looks at the whole patient, not just the hole in the patient. It starts with a multidisciplinary team, followed by the comprehensive wound and patient assessments, where barriers can be identified and removed. From there, the treatment plans are established to include dressing selection to be able to promote the ideal wound environment. These selections are based on best practices, on evidence-based, on standards of care, cost effectiveness. So for further information on wound management, I'd love to talk with you. You can find my information in the description. When the wound gets messy, call Jesse. Thank you.